Mr. Weiner.
Let me just, first of all, if it's not clear enough to my colleagues that we want to assure quality, read the quality assurance section. If it's not sure that there's going to be monitoring, read the monitoring section. If it's not sure what criteria you'd have to face, read page 3 through 5. But let's not lose sight of the forest for the trees. If you're going to get control of health care costs, we can't simply provide health care to some communities in emergency rooms. We can't wait for someone who has stage 1 breast cancer to get to stage 5. It's too expensive. It's inhumane. It doesn't make any sense. I believe in everything I've heard from my Republican friends. They recognize that in their proposals, that we need to make sure we have different ways of providing health care, that we try to encourage people to get preventative care, for example. We try to encourage people to live more healthy lives. That makes quality health care decisions, and it also saves money. What the gentlelady is proposing is to put some people at a relatively inexpensive cost, hyper supervised by the Department of Health and Human Services, to try to provide those services, to try to help steer people towards smarter decisions. If you're not, I have seen nonstop defense of the status quo, even the parts of the status quo you yourselves say need to be changed. You know, you're so hidebound to protecting our health care exactly the way it is that even the most obvious flaws you're raising red flags about. Don't worry. Acorn isn't going to go register Democrats and give smoking exams. Don't worry about it. What we're trying to do here is fundamentally change the things that we're doing wrong in health care. You're so staring at the trees, you're losing sight of the forest. Too many people in this country are getting end-of-life care at the early stages of their life because we're not giving them smart health care options. Too many people have no other choice except to go into their neighborhood emergency room to get care. It's not, you may not care about them. Don't. Care about us. It's our tax dollars that's paying. It's our insurance that's going up too high. It's our doctors that are stuck taking care of them rather than doing things that are smarter from a monetary perspective. I mean, I understand you want to parse the sentence to the line, and I understand part of the strategy is drag it out as much as possible, raise whatever red flags you can. I mean, I am surprised Acorn came up in this debate, but it's obviously one of the talking points. But let's remember a little bit about what we're all trying to accomplish here. And I'm pretty sure it's in your plan, too. It's take healthcare decisions that are costing a lot of money and try to cut them off early by making ones that can save us a lot of money and also save people's lives. This list of things that's on page 2, do you think it's a bad idea to steer people away from bad nutrition? Is it a bad idea to steer them away from physical inactivity? Is it a bad idea to steer them away from being overweight and to using tobacco? Of course you don't. I know you don't. Even in the midst of all the political back and forth, you don't believe that. And so what Ms. Sutton is trying to do and what Ms. Christensen is trying to do is say, you know what, let's put some people in these communities, supervised, chosen by the department after a long list of qualifications they need to meet, and try to achieve those things. I mean, I understand you're in love with the status quo, but I got news for you folks. You're all alone. Nobody else thinks the status quo is the best way to provide health care, and Ms. Sutton is recognizing that that's the case. So if you have a technical thing with the bill, that's one thing. But I would encourage you all to begin your remarks by saying, Ms. Sutton, great idea. We do need to do these things. Ms. Sutton, you're doing a great thing. We do need to change the way we provide health care in this country. If we get stuck in the same exact paradigm year in and year out, and we're looking for goblins in these bills in the form of Acorn or whomever else, we're never going to solve these problems. We're having a markup here, so if no one else says it, Ms. Sutton, Ms. Christian, this is a good idea. That's why we're going to pass it, and we're ultimately going to improve health care.
Will the gentleman yield?
Sir, I'll yield to whomever.
Right here.
Sure, just line up.
Sutton,
yes, sir.
Ms. Sutton, that's a great idea. The deficit this year is over $1 trillion. Thank you.
That's right, and I'm just reclaiming my time. If you want to start to get health care inflation...
Will the gentleman yield?
Here, let me just respond to the gentleman's point. I'm not 100% sure what it was.
Point?
Let me try to respond to it. If we want to try to get health care expenditures under control, We have to not be spending all of this money after people have started smoking, after they become obese, after they've made the wrong healthcare decisions. We have to try as best we can to use our doctors, use our health professionals, and use our community organizers to try to steer towards less expensive.
Will the gentleman yield?
Certainly I will.
Yeah, the problem is this proposal, as it's scored, shows massive increases in government spending that should increase the deficit, not reduce it.
Wait, requesting us consent for 30 additional seconds just to respond.
Yeah.
I have to tell you something. This is a fundamental conversation. We're going to have it throughout, I think. We are going to be spending some more money now on some things, but we are in the aggregate going to be saving a lot of money. Because
But
the amount of
if the
money...
gentleman will yield, show me how Medicare and Medicaid is done.
I'm going to tell you how.
If the gentleman would yield, do you have an example?
Time out. Let me finish my response. Let me finish.
Gentleman from New York has the
Let
time.
me explain how this is going to work.
Just expired.
Which has expired.
Gentleman from New York without objection.
Let me
Recognized
just
another
say,
10 seconds.
I'll give you an example. In your state of California, in my state of New York, we spend billions of dollars on the uninsured, billions of dollars of people who are getting the most expensive type of health care. So yes, we may provide $1 more of health care and $1 more of community outreach to prevent $5 in lower taxes in California, and Lord knows they need them.
But no economist is with you on
That's
these spending
ridiculous.
predictions.
That's ridiculous.
No economist is with you.
Everyone I know, including, I saw Mr. Steele of the
Gentleman's
Republican
time.
Party give a speech
Go
today.
ahead.
Mr. Chairman.
Chairman.
Gentleman's time has expired. Oh, I'm glad he spoke because we got a lot more people now.
Well,
ready to
Anthony
speak.
has a way of doing that.